You got it?
Mm-hmm.
Okay. I'm gonna knock on the door. I'm going to introduce myself. Hi, I'm Miss Jewel Adarian for today. And you Miss B. How you doing?
I'm doing fine.
Okay, can you state your name and date of birth?
My name and date of birth is Barbara Battles, 2716.
Okay then, can you tell me who the president is?
Our president right now is President Obama, but Donald Trump has been elected to start in January.
Okay, who was the president before Donald Trump?
It was the president, Obama,
And then before Obama?
Bush.
Okay, so recent and remote memories intact and everything. So I'm going to wash my hands and don my gloves and everything. And hand washing is the single most important thing to prevent the spread of infection and everything. So we're going to go ahead and do that. We're going to check your skin here. It's with the back of my hand, each one of them. So it's warm and dry, no lesion, abrasion or nothing. No tattoos. The nail beds are pink with good reflections and everything. And so they greater than 160, so that's fine right there. So that's nice and warm and everything. I'm going to go ahead and inspect your head here. The skull is symmetric, non-cephalic, so that's wonderful right there. So how you doing? If we doing all right, now I'm going to let you know that it's going to take about 25 or 30 minutes before we get done. If you can make sure you got time. If you got any questions you want to ask, you can go ahead and ask them right now. So that should be fine.
I'm fine.
Okay, then we're going to go ahead and look at your eyebrows. They even, symmetric. Going to look at your eyes. They fine. So there's no problem with that there. So we'll go ahead and look at your nose. It's third midline and everything. And then we're going to check your nasal sinuses. Your frontal is good and your maxillary, they fine too. So that should be good with you. So, okay. Then we'll go ahead and look at your ears. We're going to use the pen light to look in that ear. We're going to look. You got a small amount of cerebrum, that's fine right there. Look in both ears and everything. And then if we was using otoscope, we would be looking for, the gray tympanic membrane, the ears will be clear and everything like that. So that's fine. We're going to go, lips is fine, they pink and everything. No problem with that. Then we're going to get the light and we're going to check your mouth. So we're going to look at your mucosal mucus. It's fine and everything. Gingivitis is fine. Tongue is pink with a small amount of white saliva. Saliva is noted. So that's good. Then we're going to check your lymph nodes here. So that should be fine. Let me see here. So you got your occipital is right here. The pre-occipital is right here. The post-occipital is right here. And it's on both sides, pre, post, and that. Then we're going to go ahead and check the submandible node. And then the submental node. And then the other node, cervicular node, they is hard to palpate down this way. So that's fine. So we're going to go ahead and check your spine. Here it's S-shaped and everything. Everything is aligned, so there's no problem with that there. Everything like that there. We're going to go ahead and listen to your lung sounds. We're going to check them in 6 different places. I want you to take a deep breath. Okay, blow it out. Okay. Okay. No adventitious breath sound, so they is good. So then we're gonna go up here, and then we're gonna check your right here, shoulders and everything, checking for crevices and everything. Then we're gonna listen to your lung sounds here. And right here, over here, and here. Okay. Then we're gonna go ahead and just try to get you. Are we doing okay now? Are you all right?
I'm fine.
Okay then. Okay. So you fine?
Yes, I am.
Okay then. Okay. So we're gonna go ahead and listen to your heart. We're gonna check your heart sounds and everything. So we're gonna the right sternobodum. No lesions or nothing. We don't see nothing up here. It's good over there, visible over the pericardium, so that's fine with you. And then the right sternobodum, the left sternobodum, and the mid-clavicle line. The aortic is on the second intercostal space with the right sternobodum. I got to remember your right for my left, so okay. And then the pulmonic is the second sternobodum of the left. intercostal space. And then we're gonna listen to the urge point and all of that there. The mitral valve, the PMI, the point of entry. And then we have no adverse sounds or murmurs noted. Not always, but typically you can hear the S2 or more articulating the aortic, so you should be fine. S1 and S2 is usually heard at urge point. So, all right. So we'll go ahead and lay down. We're gonna check the abdomen. Okay. So we're gonna listen to your bowel sounds. So how's that doing for you?
Okay.
This is the right lower up quadrant, left lower quadrant, and left upper quadrant. So that's fine with you. So you so close, it's quick to pull your clothes up. What's the deal?
I'm
You
fine.
not comfortable, Miss Ballas? You fine?
Yes,
Okay,
ma'am.
so I'm gonna have to palpate your stomach there. Is it okay with you for a minute there?
Yes, yes
So,
it is.
so your right be your gallbladder. Okay. Is that okay?
It's okay.
And then your left would be, right lower be your appendix. And your left would be, what is it, the spleen. And then your left lower be your sigmoid colon. Okay, you can go ahead and put your clothes down. I'm sorry for any inconvenience of making you uncomfortable or anything.
I'm fine. I'm not uncomfortable.
Okay then, alright then. We're gonna go ahead and try to check your skin here. Check your toes for good capillary refill, less than 3 seconds. Gonna check your tibia here, right here, dorsal tibia. Okay, then we're gonna check right here, post-tibia. And then popliteal right in here. It feels fine, warm, no ablation, no edema, nothing noted like that there. And let me just check your radial for your wrist here. Yeah, so good 2+, on both sides and everything. This is your brachial right in here. Skin still warm, nice and moist and dry. So I think that should be doing. I think you passed the health assessment, so I want to thank you for your time. And then I didn't find any abnormalities.
I want to thank you, Miss Allison. Appreciate it.
Okay then, so we fine.
Yes.
So, all right then.